My name is Tadesse. I'm from Ethiopia and I'm the Horn of Africa Area Program Manager for Health Poverty Action. The impact of poverty on the people of the Horn of Africa is like a vicious thing. Poverty leading to diseases, disease leading to poverty, and it goes on and on, and people are suffering from unimaginable level of disease burden of, like I said, preventable causes. So it's overwhelming in a way. If people were not that so poor, this so-called vicious relation between poverty and diseases would have been avoided in a way, and people would have led a better quality of life, would have been more educated, would have enjoyed a better outcome of situations like the diseases themselves. So they would have had the power to prevent diseases, to live a better life, better quality. The main health problems in the Horn of Africa are characterized by being communicable diseases, which are by large preventable with a moderate level of input in terms of major diseases like tuberculosis, HIV, and maternal conditions like where there are no facilities for referral are major causes, as well as in children the vaccine preventable diseases are still rampant, as well as a background of malnutrition which complicates the situation in the region. The effect of these health problems in people's lives is, apart from the mortality of children and women, a lot of suffering and then leading to poverty. If you look at some of the infectious and communicable diseases like malaria, it affects a large majority of the productive group, and that leads directly to poverty. HIV/AIDS is also really shaking the human resources of the Horn of Africa, and it's really leading to poverty where breadwinners are dying at prime age, and it's leading to underlying to a very serious situation of poverty, and that I see it like a major consequence of the diseases. Yeah. Health Poverty Action has been implementing programs in the Horn of Africa for a long period, from the mid-90s in Somalia, Somaliland, and from 2003-2004 in Ethiopia, and recently in Kenya with a cross-border program. We are focusing on maternal and child health projects on a continuum of care, from contraception, family planning, child spacing, as various terminologies for the same thing, but we do also facilitate referrals for women, antenatal care services, as well as delivery with skilled hands nowadays. We also do a lot on radio health education programs, dramas on community level. The focus is like sexual reproductive health, maternal and child health in general, and we are reaching the most marginalized communities, especially on Ethiopia and Kenya side, very close to the borders, who are not really reached by mainstream programs. So we're doing a real good job in the Horn of Africa. People all around the world can help us in this effort in a number of ways. One is voicing the situation of the poor to the rest of the world. In pockets of communities like this ones, people are not reached with basic health services. They can also help us in terms of providing us with the means, that is by funding programs. I think understanding comes first before investing anything. So if they listen to us, that's the initial step, in my opinion. Health Poverty Action supporters in the UK have been doing a great job. I really say thank you on behalf of the poor and marginalized communities in the Horn. That has been enabling us in a way to reach these forgotten, marginalized people. So I really say thank you. And the support they are making is making a real difference in the life of these poor women and children in the Horn of Africa. So I really thank them and let them be with us and further support to provide to these poor people, poor communities.